The nation got a report card on obesity today, and the country flunked. Despite all attempts to attack the problem, a new survey shows the adult obesity rate increased in 23 states last year, and no state showed a decline. Here's Dan Harris.
The battle against obesity has been going on for years, with officials doing things like taxing sugary sodas, putting healthier foods in schools, and requiring longer, tougher gym classes. But still, Americans keep getting fatter. Today's study says the fattest state is Mississippi, where nearly a third of all adults are obese. The slimmest state is Colorado, but even there, 19% of the adults are obese. Childhood obesity rates have tripled since 1980. Again, it's worst in Mississippi, where 44.4% of children between 10 and 17 are either obese or overweight. This trend may only be exacerbated by the recession, as the price of healthy foods rises, and so do rates of depression and stress, which are often linked to obesity. This crisis is sure to weigh all of us down eventually, because obese people require more expensive health care, as President Obama noted today at a health care forum.
If we can help somebody control obesity, they are less likely to get diabetes. And if they are less likely to get diabetes, that means that we are going to be saving a whole lot of money in hospital costs.
The authors of today's report say the government needs to take rapid and dramatic steps, perhaps regulating food advertising to children, as has been done in some countries in Europe.
This just has to stop if we're going to have any hope of dealing with the obesity problem.
The study's authors also say the government needs to start thinking out of the box. Things as simple as requiring new communities to have good sidewalks for people to run and walk on could help, they say.
Sometimes it can mean keeping school playgrounds open at night. Sometimes it means providing the seed money to open a grocery store in a neighborhood.
Health experts have been calling for big changes for years, and to be honest, not much has happened. But the people I spoke to today say they are more optimistic about seeing real changes now, because the nation is having this major debate over health care reform, and because these obesity numbers are getting harder and harder to ignore.